Okay, so I will be discussing what happens within the digestive process and what happens when a disease such as a peptic ulcer occurs. So your food enters the oral cavity where it's broken down through the process of mastication. In the oral cavity, salivatory amylase will break down the starches, which are the complex carbohydrates, into the simple carbohydrates. The tongue then pushes the food, or bolus, to the back of the throat, or the pharynx, and down the esophagus. The epiglottis covers the trachea to prevent food from going into the lungs. Peristalsis moves the food down through the trachea, passes through the cardiac sphincter or the lower esophageal sphincter, and into the stomach. When the amylase reaches the stomach, it stimulates the release of pepsinogen and HCl. The HCl activates the pepsinogen into the active form of pepsin. This is to break down proteins. The rugae are wrinkles in the stomach that allows it to expand and contract. The bolus is churned in the stomach for 2 to 4 hours. When most of the food is broken down, the pyloric sphincter opens and allows the food to enter the duodenum. The bicarbonate is released by secretin, which goes through the bloodstream, which goes to the pancreas. This stimulates the release of bicarbonate, which neutralizes the stomach acid, making the pH around 8 or 9. Also occurring in the 25 to 30 centimeters of the duodenum, CCK is released into the bloodstream and travels to the gallbladder, which releases bile salts, which emulsifies the fats. So trypsin and uripsin and lipase and disaccharase are all released. Disaccharase breaks down the disaccharides into monosaccharides. Trypsin breaks the proteins into peptones, and then the uripsin breaks it into the amino acids in which it can be absorbed. The nutrients are absorbed in the jejunum and the ileum. In the large intestine, water is reabsorbed in the body. This was the water that was used in the digestion process, and roughage is added to the feces to bulk them up. Moves through the large intestine and is expelled from the anus. As I was mentioning earlier, a disease that can disrupt the operation of digesting foods in the duodenum is a peptic ulcer. Someone who has a peptic ulcer has an abundance of sores or ulcers along the lining of their small intestine and or stomach. Sometimes people with ulcers have no idea that they have them, but in other more serious cases, they can cause burning sensations after eating, bloating, heartburn, nausea, and weight loss. The best way to prevent oneself from getting an ulcer is to limit their intake of over-the-counter painkillers such as Advil and aspirin. Another way to prevent ulcers is to limit the amount of alcohol that the patient consumes, and not to smoke or be around others who smoke. For treatment, a recommended suggestion is changing your lifestyle to more well-balanced meals and no smoking. It can also be treated by antibiotics such as tetracycline or Biaxin.